Well, welcome everyone. Thanks. I really appreciate that the fact that Sarah and Enrique and Ola have invited me here to Sweden to talk to you about this because this place is full of innovators. You don't really need to import somebody from California, but it adds color to the things, so that's worthwhile. So you're all here for this weekend hackathon to the innovations to spark innovations, and these innovations that you're going to come up with will help shape the future. But one of the key things about innovations is really what questions you ask, because the problems that you choose to work on are going to determine what kind of innovations you come up with. The answers that you find are going to be very dependent on the questions you choose to ask, and in fact, how you frame the questions that you ask. And so in my talk today, I'm going to invite you to view things, to view health from a different frame than what you're used to. And as you'll see, I'm going to be talking about health technology for the other 99%. And hopefully, by the end of this talk, which I've never given before, so you guys are guinea pigs, we'll hopefully have sparked some new ideas. So just to be clear, we're not talking about the Occupy movement. They have this 99% thing going on too, but we're not talking about that. What I am talking about is that this is the traditional view of health, where you have some healthcare professional, some doctor, some nurse, and the patient, also otherwise known as a person. And in the traditional view of health, we look at this duality. And when traditionally we talk about technology, as you know, almost all of the technology that we develop is in fact for these people up here. It's for the doctors to use, for the hospital to use, etc. We as people are simply not in the picture for the vast majority of health technology products. There is some in terms of sort of patient interaction. We talk about these realms of patient engagement and education and telemonitoring and personal health records and so forth, which is really the interaction between us and them. But there's this question mark here. I mean, how many technologies can you think of which are designed for us when the doctors are not in the picture? There's hardly anything. And this is very surprising because for the vast majority of your life, the only person taking care of you is yourself and your family. The doctors are simply not in the picture. They don't live with you. So here's a diagram from the U.S. Veterans Health Administration making this point. They serve a lot of the retired soldiers in the U.S., and their average patient, and these are ex-soldiers back from Afghanistan and Iraq and places like that, they have health issues, but your average soldier still only ends up spending about 100 minutes a year with a professional healthcare provider. And this whole white space is the rest of the year. And in fact, this diagram is completely inaccurate. That gold dot is way too big. So here's a better picture made by our very own Sarah Rigar, who, this is her year in 2012, where she spent 1 hour with healthcare professionals, and the other 8,765 hours taking care of herself. And can you find the gold dot over here? Yeah, there it is. And so this is an accurate representation of what life is really like, even for someone with a serious health issue. And so what I want to talk about today is how do we think about health technology for this blue ocean over here. And I want to propose a framework. I'm going to start describing this thing with a very simple diagram of a person taking care of himself. The idea here is that this person has some health goals in mind and has some plans. This is what they are going to do to take care of their health. And so then on a day-to-day basis, they carry out some actions to take care of their health. They eat such and such, they exercise, they take these medications, whatever, which have an impact on their health. And of course, their health is also impacted by other things in their environment. And they pay attention to what their health actually is versus their goals and make adjustments and move on. So a very simple loop of how we take care of our health. And I just want to acknowledge, of course, that doctors and other experts influence what their goals and plans are. So this is a very nice, simple diagram, and unfortunately, life doesn't reflect this at all. So what happens? Things get complicated. First of all, actually carrying out our tasks turns out to be harder than expected. So we often fail to accomplish our tasks as we meant to. So we can't really easily measure, did taking that pill have the proper effect on our health, because maybe we never took the pill, and so forth. There's a lot of opportunities for failure in carrying out our plans. And this is because taking care of ourselves is not as trivial as taking your pill on time. Taking care of yourself involves practically anything that's involved with life. And if any of you have ever taken care of somebody else, your grandmother, a sick child, or whatever, care activities really span the entire spectrum of human behavior. And so each of these activities in itself seems trivial. I mean, how hard can it be to take your medication on time? How hard can it be to carry out your breathing exercise and so forth? But in the course of a busy day, when you have other priorities of your job, getting dinner on the table, getting the kids off to school, and so forth, it gets complicated. In fact, the one word that most people that are caregivers use is that they're just overwhelmed. So it's very easy to understand why people have failures in execution. And here are a couple of diagrams, so I'm not expecting you to read any of the words, but across here are 18 hours of the day, and this way are things that the person had to do. This was a friend of mine who was going through chemotherapy, another friend of mine who deals with cystic fibrosis. This is a person with diabetes and hypertension. And this is kind of a normal day. And all those dots represent some little trivial thing that they had to do. And this goes on for the rest of their life. So you can understand why there are so many failures in execution. In the medical world, we talk about non-adherence. Nice, simple word that does not capture how hard it is to actually be adherent. The other thing that gets messy in all of this are, in fact, all those other things that have to do with life. Health is important, but honestly, there are other priorities in life which simply take precedence. Your social responsibilities, your family responsibilities, your job, being able to pay your mortgage is really important. And so these things often, at a practical level, take higher priority. And so they really confuse the picture. Another thing that messes things up is that, with the rare exception of a few hermits, the rest of us live in families, and we have a huge influence on each other. We live lives that are very interconnected, interrelated. So for example, my doctor can give me great advice on what I should eat. It makes no difference. I'll end up eating whatever my wife tells me to and whatever she buys that's in the kitchen. I don't really have any control over this. It's one way to keep a marriage happy. But this is true of all sorts of other things as well. You might decide you want to go on a low-carb diet, but if the rest of your family and your friends don't go along with this, it makes very difficult sort of social circumstances. So our lives are intertwined. When we think of health technologies for the individual, unless you really think of that individual in their social context, it'll be very hard to make a product that the person can actually use. And I want to just, this is a diagram I've used for years to sort of just make this point, that, she might be taking care of her, but she's also taking care of her grandson, and her sister gets involved and so forth. And this is real life. We are interconnected families. This was some research that I did last summer, where I interviewed many people in caregiving situations and asked them to talk about who are the people that you take care of, and who takes care of you, and who else is in the picture. And in this case, this is actually one of my neighbors whose wife has Alzheimer's. And he talked about how his children are involved in her care, how his wife's sisters are involved, even though they live far away. They fly in occasionally to help. How there are, of course, professionals that are in the picture, and also how many of his neighbors have stepped in to take care of him, because he was so overwhelmed taking care of her. And, this is sort of normal. We all are interacting with each other. This is a very interesting conversation as well. This woman was taking care of her mother, who lived in a nursing home. So, I mean, it says there's 12 other caregivers. And yet, being the daughter, she was involved every day as well. And what was interesting, she talked a lot about how her brothers and friends really support her. And as we were sort of almost completing the interview, she happened to mention that she had one son had autism. And then we had to stay there for another 20 minutes to say, well, you're probably involved in his care as well. And yes, indeed, she was spending so much of her day taking care of him, and we found who else was in the picture. And the only sort of thing to note about that is that she didn't think of it as caring for her son. She just thought of it as being a parent. This is what parents do. And so we, as product developers, need to pay attention to this. Don't simply ask people what they're doing. You have to pay deep attention to it. So I have Apple DNA. I worked for Apple during the late 80s and early 90s and shipped some groundbreaking products with them. And Steve Jobs in particular is famous for saying that it's not the customer's job to know what they want. And he said it in a way that, the man's so arrogant anyway that it's very easy to say, well, it's just Steve being arrogant. But in this particular case, there's a much, much deeper point. If you are aspiring to do disruptive innovation, to really groundbreaking innovation, then your customers have no clue about what you're talking about. You can't ask them about this. You have to go spend your time observing deeply. You really have to understand their lives. You really have to respect their lives and their point of view to then be able to step back and say, given that this is what they want to do, even if they can't describe it themselves, here's what I'm going to do to serve them. And so this is why Apple doesn't do market research in the traditional sense, but they spend an enormous amount of time with people. There's a difference. And so again, if you're aspiring to really groundbreaking health products, don't go ask people. Go figure it out. So I've sort of, lumped all the people into this to make my diagram a little cleaner. And the last thing to note is that, too often we talk about doctors as the influencers, but, Oprah has more control over, well, she did when her TV show was popular in the US, over what people did for their health than their doctors did. Some sports star will come out and say, I'm so fit because I drink Gatorade or something, and everybody starts drinking Gatorade. So we are influenced by an enormous amount of people. Each of them might not have very strong influence, but we are influenced by them. So even outside the family, when you think of who else is in the picture, you need to look at the broader scope. So I've come up with this somewhat simple framework for thinking about people taking care of themselves. And what I want to add onto this diagram are sort of 5 opportunities for improvements in technologies that can help us. So one obvious place is, in a sense, content, but ideally personalized, customized content that helps us better find the information that relates to us. And on the one hand, this is a space that, ever since the birth of the internet has been huge. Very, very active. Every day somebody's coming out with a new product that promises to give us better information. Even within sort of the health space, MedHelp, which is a huge online community for health, has been around for over 15 years. These are some newer ones. In the US, there's constant efforts to take advantage of all the publicly available health information and make it accessible to us. And then, of course, all the social media. I mean, you can find an expert on anything if you look hard enough. And yet, if any of you have tried to really look for information that pertains to you, it's very, very, very hard to find. So even though there's like a million things out there, there's still enormous opportunity for someone to actually crack this thing and make it useful. Another space that's very hot is just all sorts of tools and devices to measure ourselves. Someone here had the latest version of the Fitbit and so forth. This is the Nike Fuel Band. This is a friend of mine in Beirut who's making the equivalent for swimmers and so forth. There's all sorts of gadgets that are coming out, devices to measure different aspects of yourself, including on you and inside you. This is a company that makes pills with little RFID things, and they send out signals as they make their way through your body. There's also all sorts of apps, apps that you sort of do manual input on. MyFitnessPal is the best-selling app in the US for people tracking their weight. especially their calories and food consumption and so forth. People are developing apps that take advantage of the fact that our cell phones have so many sensors in them. So there's so much more passive data gathering that we can do than we ever could before. And so this thing simply runs in the background and tells you every place you've been and what store you've gone to. It's sort of an automatic version of Foursquare plus distances in between. And people are developing all sorts of interesting tools to allow you to measure things that are not physical. So this is a web-based tool that helps you measure your cognitive skills at the very moment. And so you can use this thing to figure out for yourself whether, coffee or tea does a better job of waking you up. So there's ever more devices and sensors of various sorts. And even though there's like a new one introduced every day, everyone I know that's sort of involved in this feels that we're barely scratching the surface, that there's so much more to come. Just this last weekend, we were at a conference and I saw yet another sleep sensor, and this was brilliant. And I'd never seen such a thing before. So there is enormous scope for innovation in terms of sensors. But the thing about all these sensors that, in a sense, has made us aware is what's missing. So I've had this other category called analyze put in, because one of the difficulties we face is that how do we make any sense of this data? It's not enough to have a pretty chart of just your weight, or a pretty chart of just the calories that you had, or just your sleep, or just anything. The whole point is that we're sort of in a multifactorial universe, and we need to see the connectivity between all these data sources and find the correlations and causes amongst them. And to put it quite simply, there's nothing useful out there for this. So at this Quantified Self conference we're at, which is, uber geeks, people who code in their spare time, and one of the charts, which is a very simple chart with 2 lines on it, it took the guy 2 full days of programming to get the 2 different data sets into one simple chart. So even the folks that supposedly know what they're doing have a hard time. And they're using, this is an Excel spreadsheet. I wouldn't even know how to get started on creating an Excel spreadsheet like this. People in certain circumstances use R and other very complex statistical programming languages. This is a project which is the closest to mainstream that I've seen, and it's not even available publicly, at Carnegie Mellon University in Pittsburgh, called BodyTrack, which allows you to put in data from sort of all sorts of streams and view it together chronologically. And it's still being used kind of in an experimental way to help people understand how different pieces of data interact. Unfortunately, none of this is consumer grade. I work for NASA and I can't use this stuff. So it's not for mere mortals. So this is a space that is begging for improvement. Another space, which will sound odd in a moment, but are tools that help us communicate, both within the family and with the external side. And it's sort of odd to say that because, it seems like we have ever more tools for communication. And in fact, most of us these days seem to be overwhelmed by too much communication. And yet, we keep trying new things because we can never find the right combination for each specific thing that we want to do. And when it has to do with our health, there's all these issues of convenience because we don't have any extra hours of the day to do this stuff, richness in the sense of all these data sources, but privacy ends up being really, really important. Sometimes you simply don't want your sister to know about this, and so forth, and control. So it's very, very complicated. And even though we have a million tools for communicating, none of them are right. So another space that's really just crying out for a lot of innovation. And then the final space is very much overlooked, and of course that's where I find myself, is what I call enable. And you can think of it as productivity tools for ourselves. As you saw earlier, the whole reason adherence is so hard is because there's a lot of little things going on, and how does it fit into our lives? It's very, very difficult. And what most of us in this situation do today is we make do. We take advantage of tools that were designed for more business purposes in mind, and we use them in our family settings. So I know many people who are sort of siblings taking care of a sick relative, And like one of my friends simply has this ridiculously long Google Doc. Anytime anybody in the family does anything with their mother, they just make an entry in this Google Doc at the beginning. That's their way of staying in sync. And there's Evernote and Dropbox, and we're all using whatever tools we can find to make this life manageable amongst ourselves. What is missing are tools designed for the consumer mindset, not repurposed business tools. The best one I know is an app called Cozy. Well, there's a website version as well that started about 6-7 years ago, which, think of it as a family calendar. And it seems like, well, how hard can it be to stick it into here? But it is different. And so there are millions of families in the US that use this thing for coordinating their day-to-day lives. The kids' piano lessons and their soccer practices and the dances and so on and so forth. And somehow, even though it sounds at the surface like this should be able to do it, it's much, much better over there. And I'll tell you briefly about the product that I've been working on. So Unfrazzle is the latest in a series of products that I've developed over the last 8 years now. It's literally version 20 of a series of products. And to put it very simply, it helps the user remember and keep track of anything that they define as part of their care routine, whether it's the exercise they do for themselves, it's the cat's flea medicine, it's all these tasks they have to do for their grandmother, whatever they have to do, it's all in one place, and they can stay in sync with their co-caregivers. And each of them has access to each other's information, again, depending on how much privacy they want and how much control they want to give each other. And so it has been designed to sort of help in these two spaces, the enable and the converse. So I've spent a ton of years developing this thing. It turns out to be a lot harder than I thought at the front end. And tenacity, as I was saying, is really critical because it takes forever. But so that's what I've been doing, and I won't go on with that. But just to close on this idea, I've come up with a very complicated diagram, and this is the simplest I've been able to make it so far. But the thing I want to inspire you to think about and hopefully innovate around is this whole idea of remember the 99.9% of your lives where you are taking care of yourself and develop some tools to do that better. So that's it. I'll be happy to take questions and stuff if there's time. And thank you.
Yeah, thank you very much. I'll kick off. Can you hear me? You can't hear me. Yeah. Now you can. Can you hear me back there with the camera? Perfect. I'll kick off with one question. I'll leave it for the room. So think about what you want to ask. So I saw this since you're from San Francisco and you sort of been part of Apple from the early days. You probably have a better view on this than I do. I saw this professor that thought that computers were developing so fast that at some point in time they'll be a lot smarter than we are. So in order to keep track of them, it's not about making us healthy, it's making us improved through technology. So sort of the cyborg dimension of developing health. Have you seen anything there? Where do you think that is going? Will sort of our grandchildren be a lot stronger, see in the dark, sort of not only sort of remedy health problems, but actually enhance things so that we live stronger, easier, think better. Right. I would love to have an auxiliary memory, but I would remember all the stuff I'm supposed to do and so forth.
Yeah, well, there are many people who think that way. And in the Valley, in Silicon Valley, there are people, of course, with a whole variety of ideas. And part of the exciting thing about being there is hearing them all. You don't have to agree with them. You can just debate them all. So there's a Singularity University, which is very much bought into this idea that computers are going to develop so fast that in the very near future, the singularity, they're going to be smarter than us. And what is that new world going to be like, and how are we going to live in that, and how do we take advantage of it? I don't know. I mean, it's sort of an interesting question, but On the other hand, I have a bunch of friends that are leading what they call the life extension something or the other, and their idea is a little bit different. So I think the oldest person known in history lived to 123 or 122 something, some woman in France, and so their goal is to get the first human being to 123, but still in good shape, in a sense, still enjoying life. And so their idea is, who knows if we'll ever live forever, but we should be able to live much, much, much longer in a healthy way. And how do we get that? And so they are looking into all sorts of biological things of why is it that we age? Why does our body break down? I myself am focused in a sense in a much more practical way. I'm hoping they all succeed, but in the meantime, we're dealing with so much that exists today, and how can we make that better? In a sense, from the health technology space, we've been focused so long, to trivialize it, on the search for the cure. I'm looking at, well, we're putting up with this stuff. How can we live a much better life?
If you combine the two things you said, if your friends are right, and we're going to live to 120 plus, there's going to be a lot of more people that needs care, and there's going to be a lot more technology that is needed to actually support them in an efficient way.
That's right. Exactly.
I'm going to open up the floor. Any comments, questions, ideas? And the way it works is that if you don't raise your hand up now, you're a volunteer, and then I'll just give you the microphone. Yeah? So, any views? Could you pass the mic back to the lady behind you, please?
Hi, Rajiv. Thank you so much. That was really interesting. My name is Kristen Lynn. We met out there, and I, as I mentioned when we were talking, I'm a parent of a child with special needs who recently, 7 days ago, moved from Boston to Sweden. And so I'm thinking a lot about your presentation. I loved your model. One of the things I thought about when you got to, I think, point number 4 around communication between caregivers is as I lugged stacks and stacks of paperwork from my child's teachers, recreation therapists, doctors, and specialists with me from Boston to Stockholm, and then began the process of really being reborn into a completely new system. I wondered if you thought anything about what might be achieved here this weekend or in the future in terms of communication solutions that would actually allow for the coordination of care, not only between caregivers, but between professionals and families.
Right. I myself have not. I mean, it's a very important issue and a very challenging issue, and I know many other people are working on those things. In a sense, I like to think of it that I work on the trivial problems, where if in much easier circumstances, if we can't do that, then how are we going to ever solve the more difficult problems? And so I've been focusing my energies on, in a sense, what I call the mundane, which turns out to be ridiculously hard anyway. And the point being, years ago I worked on digital cameras, and I was sort of responsible for one of the first ones. And it took really lousy pictures, but it took pictures, which was a huge advance. And so, I figured we need to solve the little problems before we can really solve the larger ones. I know what you talk about is really, really important, but I'm sure others here have much more insight into that.
Any last question? Then I'll ask a last question. Sorry, you have a last question.
Today, as you mentioned in your chart, 99% of the time we take care of ourselves. So the doctors are only involved very momentarily, and they don't really care what you do during your 99% of your own time. They don't have any methods to interfere with it or log it or follow it. And I think in the near future they will have to have some kind of input into that so that we can make the whole care much more effective. What is the biggest obstacle? How can we make the doctors encourage patients to take care of themselves while focusing on the patients that really need it?
So a couple parts to your question. One is the first part, how do we encourage people to take more care of themselves? And I struggle with that question because I'm not sure I buy the premise, in the sense of, are people not taking enough care of themselves? I think it's actually a legitimate question. We have many responsibilities in life. And if, as an example, if you're a parent, there's 1 million parenting books out there. And I'm sure you could read any single one of them and know that what you're doing is wrong, or that you could do better. And of course, that's not how we think. We say, we're parents, we do the best we can, and we raise our kids. I think we really need to think of our health management in the same way, that we have many responsibilities in life. We're doing what we can, given what we know, and making a go of it. So I think in that sense, we need to think much more about how do we help people take better care of themselves than any sense of we need to motivate them to take better care of themselves. I think there's but on the other hand, I think if you speak to any doctor as a person, You know, he got into this field to take care of people. And if they have better information so that they can do a better job of treating them, I think they would like it. All sorts of institutional barriers get in the way, but as doctors, they want to do that. But I don't think that they should be burdened with taking care of us, the other 99.99%. It's like, if I break an ankle, I want to go to the ankle putting together specialist to go and fix me. But on a day-to-day level, I think we're the only ones who can do the job.
We have on Digital Health Days, one of the speakers, Mona Ismaili, she's a scientist and she studies aging. And she says, reversing aging takes a long time, but if you can hang in there for the next 40 years, chances are I can give you another 40. So that's sort of a challenge. So I want to thank you very much, and you'll be around, so there'll probably be a lot more questions later. Thank you, Rajiv.